So good afternoon everybody and welcome to the next in our series of a chat with Caroline. Just a reminder to use the chat facility on your screens to leave any questions you may have for the team over the next sort of 15 minutes or so. I'm now going to hand over to Caroline, who will start off our broadcast. Thank you, Caroline.
So hi everybody, thanks ever so much for listening in this afternoon. Just a few things to update on before I come to a guest that I've got today that I'm delighted to have with me. First is, in the last few days, we spent some time at the end of last week, the Listening into Action team out for a couple of hours to look at how we're doing and how can we strengthen our whole approach to listening into action. I think overall we're really pleased that there's been lots of traction, lots of great conversations. We've now got 15 groups up and running, according to all the feedback you gave us on the improvements that you want to see, so that's great, and lots of people involved. What we particularly want is teams themselves to really get on and make the improvements that you're asking for, and particularly with team leaders, making those decisions, making those improvements and letting us know that they're happening. Because even though you might think it's a small thing in your team, if you can achieve that, we can spread the word, then that'll really help in other teams as well. And can you really think particularly about your quick wins as well? And again, let us know through the LIA team what quick wins you're achieving day in, day out. So thank you ever so much for that. A couple of just reminders for people, please. We've got two big campaigns going on at the moment. As you can hear from my croaky voice, I've managed to pick up some sort of cold, certainly not flu. And yesterday I actually lost my voice to a lot of people's pleasure that were around me. But it is really important that we all have our flu jab and protect ourselves and protect our service users and carers. As you will all know, we have a target this year of 80% of our clinical staff having a flu vaccine. And at the moment, we're only at 34%. So anything you can do to encourage people around you, to take responsibility for yourself to have your flu jab. I think we've got a series of different prize draws and things that entice people to have the flu jab. So please really do encourage people to do that. It's really important for us. And secondly, a plug for staff survey. So we're 3 weeks into our staff survey at the moment. Our response rate is okay, but not great. It's about 22%. We had the highest response rate for our Listening into Action pulse check that any community and mental health trust had ever had. So let's really try to get up there in our staff survey. We had a 65% response rate. So again, we've got treats for people. I think you could enter a prize draw to get extra days annual leave and other treats for your team, health and wellbeing events and time out. So, and if you think that there's other incentives that would help people, then please let us know. But again, really want to hear about how you're feeling it is to work in our trust at the moment. And then I wanted to just remind people that we've got our clinical strategy workshop that's taking place this Thursday. So this is across the whole trust, and again, lots of people, please do engage. I know we've got a lot of people already invited. If you want to attend and you haven't yet booked in, then please do contact Paul Bibby. So on the whole focus on strategy, I know there's a lot going on at the moment in terms of improvement. We've got Listening into Action, we're developing our new clinical strategy, and we've got our, obviously, strategic relationship with Cumbria, Northumberland, Tyne and Wear. And obviously today, our chat is particularly sharing how all that work is going in terms of our improvement work. So I'm firstly going to ask colleagues to introduce themselves, and then I'm going to ask Russell to talk to us about some of the early ideas and successes and a bit of our ambition of what we're hoping to achieve. Shall we just introduce ourselves, Louise, please?
Hi, I'm Louise, Giles, Head of Transformation.
Good afternoon, I'm Russell Patton, Executive Director of Operations.
Hi, I'm Alison Mellor and I'm a Service Manager in Pennine and I oversee 4 of the CMHTs in that area.
Hi, my name's Fearn. I'm the Service Manager for the bed management hub and integrated discharge team.
Brill. So if we now go to Russell, just let us know what we're trying to do and how's it going from your perspective.
Okay, as Caroline mentioned, we've developed a strategic relationship with colleagues from the northeast of England, and many of you will have had the opportunity to go and visit some of the services and meet some of their staff when they've come down to work with us. It's important, I think, at this stage to recognise that they have a particular set of skills and competencies which we will be utilising over the coming weeks and months. But just as important, we need to, as an organisation, develop the skills ourselves so that as we move forward, we can take forward transformational change on a regular basis. In terms of the work that's commenced recently, there's two big work streams. One is linked to the review and transformation of the bed hub. Many of you will be aware that the bed hub and the bed management service, which is based over at Blackpool, is probably ripe for change. We have a number of individuals, a number of clinical staff who have some great ideas in terms of how we can make the inpatient bed flow more effective, how we can manage the OATs more effectively, and how it, just as a system, we can make some change which will benefit primarily the patients who we serve, us as an organisation, and the system that we are part of. And that work has commenced, and obviously colleagues will talk at length about that in a few moments. The next big change is in relation to the redesign of the clinical pathways within the Pennine Lancs ICP. Again, this is a significant piece of work which will involve clinicians, managers and leaders from that particular area, as well as clinical experts from different parts of the organisation and from Cumbria, Northumberland, Tyne and Wear. The expectation is that this will be a significant change process. It's not a case of us going in, making change and walking back out. This will be fully integrated transformational change involving ourselves and key external stakeholders. We recognise that there was particular challenges with the Pennine Lancs ICP area, and that's why the decision was taken to commence this work then. It's important that people don't feel that we're focusing all of our efforts on that particular patch. As things progress, we will take the change processes and introduce those with the respective home teams in different parts of the organisation. So those are the headlines, and I'll ask colleagues just to take forward and give you some more detail in terms of the changes to date.
That's great, Russell. Thank you ever so much. So, Louise, you're obviously Head of Transformation. This presumably is one of the projects that you're working on. Just tell us a little bit from your perspective, how's it going and what your team have been busy doing?
It's going really well. We've been working really closely with Cumbria, Northumberland, Tyne and Wear. And we've had a lot of coaching and training in terms of their approach, which is very different than how we've done it previously. And we've undertaken the 5-day bed management event, and we've just finished evaluating that and writing that up, and I know Dawn's going to talk around some of the outputs from there. And we're also now in Pennine doing a big piece of work around diagnostics, so we're spending a lot of the time with the clinical teams. We're observing them, looking at what gets in the way of day-to-day, trying to see patients. We're also looking at getting staff, interviewing them, getting their staff to tell us what works well, what doesn't work very well. We're analysing data, reviewing patient notes. We're also doing workshops with service users and with stakeholders to make sure, whilst we've had the NTW report, just to make sure that that's up to date. We've also held training, and we've held that with Pennine, with the clinical teams around observations. So the Pennine clinical teams were aware of what we were going to do.
That's great.
And they were also then able to accommodate. And I have to say the feedback from my team about going into the clinical teams and the feedback from the clinical teams has been really positive. It's felt like a real partnership rather than a corporate service. It's coming in and observing.
That's great. And so, Dawn, obviously you're the service manager for the work that's gone on in the bed hub. It's great to have heard from Louise that we're involving staff, service users and partners. How's it gone from your team's perspective?
Yeah, so the 5-day event, it was well-attended event by both clinical, non-clinical staff and some of our stakeholders as well. So it was really, really good to get that really rounded approach. It was really, really good in terms that everybody in the room had a real voice and understood what some of our challenges are and where we are now and where we want to be. So the term what was used quite a lot during the week, which I think was really positive, was around blue sky thinking and so kind of where we want to go. And so on the back of that 5 days, we've prepared the review. Obviously, we may not be a point yet that we are literally at blue sky days, but we wanted to look at some of our quick wins.
Great.
So we prioritised some of those, and one of them was around the estates. So looking at how quickly we can mobilise and move the bed management hub to, a better estate, so that we can have better improved IT equipment to support the flow of calls both in and out of bed management. We looked at things around...
And just to ask, where are we with that and what are the
So
thoughts?
it looks like we've found an estate. We've got an enabler workshop on Friday this week with our colleagues from the network around IT, estates, HR, because obviously we need to involve everybody in that.
So a better venue.
Absolutely, yeah, more central
people
and a really nice big room, which will, I think, be quite a good win for the staff, really, all involved. So looking at improved IT equipment around Cisco phones, really good headsets, because sometimes that's an issue for some of the teams working in there. Looking at introducing a switchboard function so that not all calls about everything but bed management, goes to the switchboard, and we can have dedicated phone lines. Things like we looked at a quick win around really implementing and embedding a discharge process. So for the wider bed management team, we've got that embedded discharge process that the whole MDT can be part of, which will hopefully improve flow. We've looked at how we're reviewing our out of areas, so again, which will improve flow and improve patient experience as well, so they're not hopefully having to go to the all four corners of England for mental health treatment.
Really important.
Yeah.
And what are we doing in terms of a team that's supporting people that are out of area?
So we we will have by the 4th of November a centralised OPE review team, which will be supported and headed up by our enhanced flow team in-house, so that we've got clinical teams, team members from each locality to support and review, face-to-face review of those OPEs, so that we can have a better grip on them and ensure that we are reviewing them, and hopefully those numbers will come down. And
so these are service users that are being cared for outside of Lancashire and South Cumbria.
Yes.
That the team will proactively go out and see what their needs are and how quickly they can return to their home. County.
Either that's by a repatriation to a locality bed or discharge back into home.
So it's better all round.
Absolutely.
For everybody.
Yeah.
Okay, brilliant. Alison, can we come to you to understand obviously the work that Russell talked about in terms of Pennine Lancs, which is going to be the first locality for us, but we're wanting to spread this across obviously the whole trust in time.
Yeah. So as Russell mentioned, I was lucky enough to be one of the members of staff who's been up to Northumberland, Tyne and Wear, and that was a really exciting opportunity to see the work that colleagues do in that area. I was particularly excited about the work they do, where they have actually a police officer embedded in one of the teams, and we were quite fortunate really. The police officer was eating his lunch at the time but didn't mind still talking to us, and he was just telling us how the amazing work that he's able to do with his mental health colleagues, and the significant reduction that there's actually been in people who were picked up on a section 136 of the Mental Health Act and taken usually to an emergency department. So I guess I'm excited.
That was something that really struck
Yeah,
you.
that really struck me. And as I guess people will know, that's a huge pressure for us.
Yes.
And I think, obviously puts some strain as well sometimes on our colleagues who are working in ED as well, and obviously colleagues in the police.
So have we got the police involved in the work that we're doing going forward?
Yeah, well, going forward, we're
Great.
doing the work with our partner agencies.
Fabulous.
And as Louise mentioned about the observations have been happening in various teams. And I know staff, again, were really excited about being part of this, although I do know that some staff were, I guess, had some reservations because they've been involved in transformation work before, and for various reasons, perhaps it's not been followed through. So I guess I see as part of my role encouraging staff that I genuinely believe that this time it will be different.
And that's quite a theme, isn't it, across the trust,
Yeah.
which is what on earth is going to be different this time.
Yeah.
We've had lots of initiatives in
Yeah.
the past that haven't necessarily lasted.
Yeah.
And do you feel that there's starting to be an understanding that things are going to change?
Yeah, I definitely think that, Caroline.
Okay, good.
And also, as Louise mentioned, there are a number of workshops happening in Pennine over the next few months. And I guess it's a plea to anybody out there listening. We really, really need clinicians to get on board. And because it's the clinicians who are on the shop floor, who are facing the challenges on a day-to-day basis, who will be able to help us find the solutions with their, skills and knowledge that they already have.
Okay, and I guess it's difficult for people because they'll be thinking, how am I going to give up
Yeah,
the time?
yeah.
But I guess it's us really encouraging
Yeah.
as leaders for people to
Definitely.
allocate that time, which
Yeah.
is great to hear from
Yeah.
you as a senior leader.
Yeah.
Because we're not going to design the future, people have got to be involved in that. haven't they?
Definitely.
Yeah.
Yeah.
Okay. I think we might have a question that's coming. Keep them coming, folks.
Yeah, it's quite topical actually. It was asked a few minutes ago by SM. Will there be any further workshops in the future, and where? I don't know if Caroline, anyone could take that on.
So I think, Russell,
Yeah,
there's lots of workshops, isn't there?
I don't think
Dates.
our staff need worry about the availability of workshops. I think it's important to recognise that what we have at the moment is the initial list. Each of the pathways in turn, be that psychosis, non-psychosis, learning disabilities, children's and organic, in themselves have a number of workshops to ensure that the pathway is designed in the most efficient and effective way. So this is a starter for 10. I can really only emphasise that this is a significant piece of work that the organisation signed up to, so we won't do it half-baked. If people require workshops and time to consider, then time will be given.
That's great, Russell. Should we just hear from Louise just to let people know when the workshops are?
So we've got 2 workshops before Christmas, which are both 3 days. We've got the first one, which is Access, which is the 2nd to 4th of December. And then we've got Assessment for urgent and non-urgent adults, and that's 9th to 11th of December. But we have booked the venue for the whole week, and it's open late. So we'll be leaving things on the wall, an opportunity for people who can't come to the workshops to be able to input.
And just on that, it's for adults and older people, isn't it? Not just adults.
Adults
So
and older
that's
people.
great. And then after Christmas?
And after Christmas, we've got the Psychosis Pathway, which is the 7th to 9th of January. Non-psychosis pathway, 13th to 16th of January, and then cognitive pathways, 20th to 22nd of January. And then we're planning, as Dawn mentioned before, an enabler workshop with all the relevant teams to look at IT, everything that comes out in terms of planning.
So people probably won't know what the language is, enabler workshops. This is something that can help to achieve our outcomes. So things like IT or being in the right building,
Yeah.
for example. Okay, that's great. Okay, are there any more questions that have come in at all?
Not at this stage, Caroline.
Not at this stage. So I think we'll probably wrap it up there. As always, please ask questions afterwards. It's great now. We're monitoring how many people are both listening in live or watching live and are watching YouTube afterwards. And we're up to about 500, sometimes more, up to 700. So that's really great. Really encourage you to ask questions live as well going forward. Our next chat with Caroline is on the 14th of November. It's at 9:30 in the morning, and it's going to particularly focus on how we're going to work with service users and carers going forward. So really, really important. And it was great today to hear that service users and carers have been integrally involved in all the work that you're doing. So please do dial in and web in, should I say, and join in with us. And thank you ever so much, and thank you to the team.
Thank you.
Thank you.
Thank you.